Thank you. Hi, everyone. I'm Anna Ostring, and I'm a digital strategist at Previa and also the head of business development. I'm going to tell you about how we're working with connected data in Previa. Previa is a Falk Group company, and it's the largest occupational healthcare company in Sweden. We are a B2B business, and the task for the occupational healthcare is legislated by the Swedish law. And it says that we should prove the connection between work environment, health, leadership, and productivity. Another big services that we have is that we administrate our clients' companies' sick and recovery notification for like 400 Swedish companies. That means that the employees at the companies calls us when they are sick, and we register that and give the manager a notification and that the employee is home sick today. This is where we come from. The picture shows how we used to expose data from the sick and recovery database. It's structured in an old way, and it's hard to understand and to make sense of all the data that we're having. And it also shows the data from the sick and recovery service, and not from our health examinations, and not from any other of the systems that we're having. Our customers keep asking Previa in our meeting how that we are meeting the employees every day, and which connections and patterns do we see in their particular workplace. And the problem is that we can't answer that question. So we're having a problem. We have too much data and no clue what to do with it. And what's the point for our customers to stay with the traditional occupational health when we can't give them a better analysis than a startup company with a much groovier and cooler offer? And then we found Neo. And Sara and her team went over to San Francisco for a 5-day sprint just to find how we could work with all the data that we're having. The sprint was this time not only data-driven, but also design-driven with an end-user focus. Our aim was to find out how we best could put our data to use in the hand of our clients. So why did we do the sprint? To be able to answer the customers' questions, and to be able to see patterns and connections, and to produce decision support for our doctors, nurses, physiotherapists, and psychologists, so that we could give our clients the best and most reliable advices. We have to move along as well, so that we can create better products with a higher value for our customers, so that we can answer the questions and give advice in advance, and so we can compete with the startup companies in our branch. And what kind of data do we have? I've said it before. We're having about 7,500 companies as customers. About 1.1 million employees are connected to us, and we're receiving like 365 sick leave notifications a year, and we're doing about 40,000 health examinations. And now we focus on data on the sick and recovery database. It's a real-time data, and it tells you about the short and the long-term sick leave, absence, and if the illness is perceived caused by the work environment. And this is just the beginning. We're having the lifestyle data, and next stop is to connect the data from the health examinations with the data from the sick and recovery data. And we will be able to answer our customers' questions. Which pattern do Previa see in our company, and what should we do in our particular workplace to prevent burnout and stress-related absence to increase health?
Thank you, Anna. My name is Sara Johannesson, and I will now talk to you a bit about connecting the data and what we've actually done with it. So this is the current data model that we've implemented in Neo4j, and today we're going to focus on the most interesting parts of it, and we're going to start with a person. So we're going to focus on the person since we want to focus on the health of an individual this time. So this person has an employment at a company. When a person calls in sick, we put the absence we connect that to the employment. When a person calls in sick, they also have a condition. It's like, why do they get ill? And that condition is connected to the absence, that connected to the employment, but that condition is also connected to the person. The condition could, for example, be a cold or a back pain. We also connect the condition to a service, since Previa is since Previa have a lot of services. If you have a back pain, maybe you need to go and see a doctor. So in that case, you can follow the employment and all the absences and conditions and services one person has had through the employment, but also as a person, if the person gets new employment. And the connection of the service is also tied to the employment. So in this way, we can find, these are examples of simple patterns. We can also here look for larger patterns and that has previously been hidden. This is also where we can find patterns that have been hard to search for in the earlier infrastructure. This is another example that is pretty simple, but has been hard for us to find before. So this is Charlotte Kalla. She's a skier and she's employed at the cross-country team. She got a cold, an ear infection, and a stomach flu. When we look into our data, we can see that Stefan Löfven, who is the Prime Minister in Sweden, he's hired at the government, also had the same diseases. While Stefan Löfven got burned out, we can now see, and he got burned out and he got rehabilitation to get well again. We can now see and make sure that this doesn't happen to Charlotte Kalla. So instead of her getting burned out, she can get the rehab. This example is just a fake example. Charlotte Kalla and Stefan Löfven are perfectly fine, so just so you know that. Another example of patterns that we can see is this one. So in the middle, we have a company that has 2 departments, and each department has 3 employments. You can see on the department to the right that people are only had 1 absences per employment, and to the department to the left, they had 3 absences per employment. Here we can look for not only patterns within the person, but also within the workplace. So maybe there is something that you need to look at in the room, maybe the air is bad or something else, or you actually have a problem with the boss. So this is also a new example of how we can use the data and find the hidden patterns. So with all this data, we've built a new tool for a healthier work life. And this is what it looks like at the moment. So we just want to make sure that you as an employer get an easy overview of your employees' health and their status. If someone is calling sick today, you can see that and you can see how many are absent. Maybe you need to call in some extra staff for your business. You as a boss also want to be notified if there is something that you need to act on. There could be if someone is absent because something work related, or if someone's been sick more than 3 times in 6 months. That if that happens, then you have a 50% higher risk of getting a long-term sick listed. So if I get that notification, then I can act on that. We can also help the employers tell them how to act. So this is where we can suggest everything from just talk to your employees or give them some kind of treatments or services to prevent further sick leave. And down here you can see how many has been absent the last 7 days and what kind of services people are in through right now. This is another overview of the history of the tool. Here you can see how many are healthy and at work, and also how many has been long time absent and short time absent. Here you can you can see the trends from last year and this year. So this is the trends from the last 12 months. And this is also, you can see why people has been away. If you look at the architecture of this, you can see here the old system. We have all the data stored in silos, and all the silos are connected to a data warehouse. So we built in our data, so we built an export from the data warehouse to Neo through data collector written in Node.js. The rest of the tool is built on Grand Stack. So it's GraphQL on the back end, it's React and Apollo on the front end, and Neo4j database as the main database. Oh, sorry, I was clicking too fast. So the backend is also built on Node.js. And what you can see here is the old versus the new, how we've been working with data on a total different way, and what a difference it makes to the tool that the users are actually seeing. Hopefully they're liking the new one much better. So what we've done here is we went to California and worked with Neo in June, and we started looking at this tool and started building this tool in October. And we are now testing the tool with our clients. We actually run into some issues. We wanted to have a product launch by now, but there are still some issues in the data that we need to figure out how to do. But we're getting there, so we're hoping to have a product launch by next month. And after that, we're looking into having a full HR tool for the whole of companies. And what we want to do with this is also, we have a bigger vision for this, with an additional connected health data that Anna was talking about before, the lifestyle data. We totally can see that we can do reports that are so much bigger and have a bigger impact than only for the individual. Of course, we want to build tools for individuals and employees, but we also want to make so much better predictions with all the additional data, and that could be everything from adding weather data to nutrition as well. But we also want to make these super nice reports, insights and analysis reports, to help governments have the correct reports to be able to change the regulations and laws to have a healthier workforce in countries. That could also help a lot of companies as well. That was all from us. Thank you.
Okay, great. Thank you so much, Sarah and Anna. That was awesome. To everybody listening, if you do have any questions for Sarah and Anna, please do type those out in the questions box on your GoToWebinar control panel, and I'll try and read some aloud in our remaining time. So we have one here. Could you please elaborate a little bit more on what was your process in selecting and kind of getting started with Neo4j?
So, well, we saw when Previa came to us, so since I am a consultant, I work at Doberman, when Previa came to us, you said we have all these this data and what can we do with it. We've previously been working with Neo4j in a couple of other projects as well. And Neo4j is a perfect way of, it's so simple to start with because you don't have to change your infrastructure from the start. So you can build that on top of the old one. And since Previa has so much different kind of data from so many different databases, Neo4j was a perfect fit for us. And Previa also has so much data and so many different data sources coming in, also not only now, but also for the future.
Okay, great. And has scale been an issue at all? So has Neo4j kind of been able to manage large amounts of data quickly for you?
Yeah, that scaling is not an issue for us now. Not at all.
Okay, great. So I think that's all the questions that we have for now. Yeah, so thank you everybody for joining. Thank you for Sarah and Anna for the amazing presentation. A reminder, I will be sending out a recording and a copy of the slides to you later today, so just keep an eye out on your inbox for that. And with that, thanks and enjoy the rest of your day.
Thanks for having us.
Thank you.